Hi there, welcome to my YouTube channel, and today I'm going to speak about the cost of IVF in Goa. My name is Dr. Mayur Pai and I am the Chief IVF Specialist in Pai Hospital in Vasco, Goa in India. Always we find that the couples come to us, they know that IVF is going to give them a very good result. However, what they are worried about is the cost. They want to know what is the cost of the medicines, they want to know the cost of the treatment, and they want to know what are the hidden charges. So we have gone ahead and made this video specifically for you so that you know completely how the cost of IVF is estimated and how we go about doing it. So Pai Hospital is a women's specialty clinic and hospital in South Goa, which is in India, and we specialize in all forms of gynecological healthcare including IVF. The hospital has been established in 1985 and is still one of the premier centers for infertility in Goa. We find that whenever a couple walks in, they may be investigated prior to coming. They may have a file which contains their previous investigation, some few reports, their past experiences. Some might have undergone a few treatments, some of them might be freshers. We often find that any couple that goes in for IVF has been previously treated. So there may be a few IUIs, a few IVFs, or there may be few timed intercourse treatments. So we go through all their files, all their past reports, and we basically find what is the patient's history. So now that we know your history, we would like to go into the future. We would like to know what is your present diagnosis and how your fertility is doing today. We traditionally begin this with the wife's ultrasound. An ultrasonographic examination of the woman gives us a complete idea about the wife's fertility and her pregnancy chances. It also gives us an idea about any new disease that has come out right from your last investigation till today, and if the disease may require any surgical correction prior to undergoing IVF. If she requires any correction or corrective surgeries or any pre-treatment, then the cost of such a treatment is calculated and the couple is informed about it. There may be times when the woman may have some pelvic infections, some fibroids, or some other new disease that was not discovered before. So in case of fibroids, there is something called a myomectomy surgery which may be done laparoscopically or by an open method. We all know that fibroids decrease the chances of fertility, and any fibroid which may undermine or impinge upon the endometrial lining does require to be removed and the uterus requires to be repaired. Also, there may be other diseases like adenomyosis which may affect the lady's uterus that requires to be corrected. The lady may have pelvic infections, and a condition called hydrosalpinx may also exist. In hydrosalpinx, the lady's fallopian tubes are filled with a toxic fluid of infectious origin which may cause very poor results or very poor implantation results in IVF. Hence, such a disease requires surgical correction, and whatever is the name of the surgery, we tell the patient, we tell how the surgery is going to be performed and also the cost of the surgery. So the couple is pre-informed before going in how it is going to work. Also, as far as the husband is concerned, we do what is called a semen analysis. This is not the routine semen analysis, but we go into a detailed semen analysis in which we focus on the sperm count, the sperm motility, and also what is called the morphology or the shape of the sperms. All these things are very important because we often get couples in which the male partner or the husband has very poor sperm parameters. We want to tell you whether you require a donor sperm or not, whether you require some specific treatment called ICSI or not. Now, ICSI is an add-on treatment over and above IVF which is specifically made for couples in which the male partner has very poor sperm count and yet wants to be the father of the baby. That means he wants to use his same sperms, his own sperms, for the conception. If this is done, the couple requires to pay the extra charges for ICSI. How much it would be calculated and told to the couple beforehand. Also, in cases where the couple does not require to go in for ICSI, the couple will be told that, and they will not have to pay the unnecessary charges of ICSI. Once the diagnosis of the wife and the husband or the male or female partner is made, we are in a better position to give a complete cost estimate to the couple. So how is this cost estimation done? A single cycle of IVF may cost anywhere between 1 lakh to 1.5 lakh rupees to the couple. This is inclusive of all the hidden charges or whatever is the additional fees that the couple may require. Most of our charges are inclusive of what is called a blastocyst culture, as our center specializes in doing what is called a blastocyst culture. A blastocyst is a highly specialized embryo which has almost a 5 to 10% increased chance of embryo implantation into the womb. So definitely we would want most of our couples to conceive, and even a 5 to 10% improvement in the chance is very important to us. Also, now if the lady does not have good quality of eggs, this would be proved in the ultrasound report right on the first visit. Also, certain blood tests or specialized tests may be required to go in for a more complete diagnosis of the woman and the man. If all these reports tell us that the lady's egg count or the oocyte count or the antral follicle count, or also called the ovarian reserve, is low, what do we do? So if the lady is a candidate for donor egg IVF, it will be discussed with the couple beforehand. Also, the cost associated with donor eggs and the IVF of donor eggs will be told to the couple, and they will be completely aware of such a thing right at the start of the treatment. We at Pi Hospital like to avoid surprises to the couple. We do not want the couple to suddenly find out that we require donor sperms or donor eggs without any prior intimation. All our couples right at the start would be informed what is their fertility status and whether any donor sperms or eggs are required in her cycle. So then comes the cost of freezing. So what is freezing? Imagine whenever you go out and order for some food, let us say you ordered for biryani. Say you cannot completely have the biryani, and whatever remains requires to be kept in your fridge. So the same thing applies to IVF. If the couple undergoes IVF and we find that they have produced a large number of embryos, say more than 5, then we always encourage them to undergo freezing. Why freezing? Because embryo freezing allows the couple to have a completely new cycle without the added burden of the injections and the medications and the anesthesia. It also is very cost effective to the couple and have sometimes yielded very good results. So freezing is not for everyone. Freezing can only be done if the couple produces large number of embryos, as I have said earlier. If the couple is not in a position to produce a large number of embryos, freezing does not work out. Freezing will not be told to the couple in this case, and nor will the specific cost of freezing be required in them. So as a couple, if you add up all the costs, you will come to a gross calculation of how much would be your expenses. Also, we help the couple in understanding how IVF treatment works. We have to know that various marketing strategies and various other internet related phenomena have glorified and over glorified IVF. It is not so. Worldwide, the efficiency or the success rate of IVF stays the same at 30 to 40%. Sometimes it goes higher or lower depending on specific couples, whereas the average stays the same. So it is very important that the couple understand that not always will they conceive in a single cycle. If further cycles can give the couple a live baby, we will be informing them, and also for every couple we roughly give you an idea of how many cycles may be necessary to give you what is called a take-home baby or a live birth. It is important and very important to consider this fact as well. Sometimes a single IVF cycle does not give you a success, whereas a multiple cycles done at the same center back to back may be the key to your baby. I hope you liked this video. If you have liked it, please press the like button, and if you haven't, please tell us why in the comment section below. Do remember to subscribe and press the bell icon so that you have more access to these informational videos, and you do motivate us to produce more of such content. Thank you so much. And in case you want a consultation with our practitioners or with me, you can contact me at the number shown below. Please like and subscribe and see all our videos on our channel to have a complete idea of what we are doing and how we are making the babies in Vasco. Thank you so much. Have a great day.